Today we have Lea Bertoni joining us. She is an occupational therapist and a certified driver rehabilitation specialist. And she's going to be talking about driving and all those good things related to Parkinson's. So Lea, I'm going to go ahead and hand it off to you.
Okay, thank you. Hi, everyone. So I just wanted to start. So I'm with Driving to Independence. We're located in Arizona, and we have offices in Tempe and Tucson, Arizona. And just to give you a little bit of history about me, but I graduated from Duquesne University in Pennsylvania with a degree in occupational therapy. I have some background working in hospital and inpatient rehab, and then I've been doing driving rehab for about almost 6 years. So that's kind of the background there. So one of the big pieces with driving, of course, it is one of the highest level skills that we can do. And we do drive for a variety of reasons. Of course, independence is one of the big pieces of that. Just being independent and getting to different day-to-day errands like the grocery store, the pharmacy, the bank, those kinds of pieces. Mobility, convenience. So that's a big thing that most people just describe as a reason they want to drive. They don't want to have to rely on others, and they want the convenience of being able to just jump in the car and go when they want to. Socialization is another big piece of driving. So of course, driving to meet friends out for dinner, driving just to go to the mall and shop, those kind of aspects, as well as enjoyment and identity. So a lot of times, when people are driving, they've driven for quite a long time, and it becomes just part of who you are, part of your identity. And sometimes people even just enjoy driving just to jump in the car as pretty therapeutic. So that's a little bit of, the main factors is why we want to drive. So I'm going to show you guys a little bit of a video here. It will work.
Parkinson's disease changes the way your body moves. It can cause extra movements or tremors. It can also make a person's body very slow to move or react. You may find it hard to move after you've been still for a while. Parkinson's can also cause short-term memory loss or problems with clear thinking, and can cause you to confuse basic rules of the road. It can affect your ability to judge the space between objects, such as the car in front of you, or a car parked next to you. The medicines used to treat Parkinson's disease can cause problems such as sleepiness, blurry vision, memory loss, or confusion. If you notice any of these side effects, make sure you discuss them with your healthcare provider. A driving rehabilitation specialist can help you identify how Parkinson's disease affects your driving.
Just a little bit faster than that.
This specialist may be able to recommend adaptations to your vehicle that can make driving easier and safer for you. As the disease progresses, driving may become too dangerous to continue. Talk with your family about your transportation options. Plan ahead for a time when driving may no longer be possible. The car is only one way to get around. Stay safe, for yourself and for others on the road.
So that's just kind of a little precursor to how driving rehab specialists and their role could play into addressing potential driving issues with Parkinson's. And I'm just curious for the group, how many of you are patients themselves who have a diagnosis of Parkinson's?
I think you can.
Are there any also family members for different patients or loved ones? Okay, good. So next we're going to just talk a little bit about how Parkinson's can affect different driving skills. Oh, sorry. Did someone have a question?
Well, no, I missed you.
All right. So as far as Parkinson's and the different effects it can have, so one of the biggest pieces is it can affect our motor skills. So different aspects of driving, I think about, of course, you think about driving the car, different things like braking and acceleration, their reaction time, muscle control to maintain the pressure on the brake. So at like a long red traffic light, a railroad crossing, how they're coordinating the accelerator and the brake. Are they mixing pedals? Are they hitting both pedals simultaneously? Vehicle control with turns, and then cervical range of motion. So like looking over your shoulder for backing up, merging, and or checking blind spots. One of the other pieces that we look at is outside of the vehicle. So how are they able to transfer into and out of the driver position, as well as their balance and ability to stow and retrieve their device. So that could be like a walker or a cane, different aspects like that we're looking at.
Hey, Leah, real quick, can you try closing and opening that PowerPoint one more time? It got pixelated again.
Oh, okay, no problem. Let me try that.
Thank you.
Okay. Let's see is that any better?
Go ahead and share your screen again.
Okay. Oh, I wonder if it's, I'm gonna stop sharing it for a minute and try to reshare it. I wonder if this. Is that any better?
Yes, a million times
Okay.
better. Thank you.
I think there was a setting, it was like optimize video clip or something, and that might have pixelated it more or something.
Nope, that's great. Thank you so much. Sorry for the interruption.
That's okay. All right. So just to kind of go back here, I'm sorry. Okay, so the motor skills, which we just talked about, and then there's some different cognitive skills. So things that we might see like speed control. Sometimes when people are having a little bit delay in processing, they might show signs of driving too slow for the traffic conditions. Also the cognition is as far as, how are they making decisions of when to turn at traffic lights, some pathfinding things. So are they able to get their way from point A to point B, or are they getting turned around? How is their attention, and are they distractible at all as far as the attention to road signs, attention to different traffic patterns, and ability to adjust for those things? And then one of the big ones that sometimes we can see is the multitasking ability. So can they process multiple things going on at once? Of course, with driving, there are many things to pay attention to at once, and that can be an area that we see decline first on the road. And then there could be some other cognitive things such as memory. So are they, placing the vehicle into park at the end of the drive, or do they forget to shift it into park? Are they forgetting to use their turn signals or shut off their turn signals? And then as far as also stopping appropriately. So at times we can see signs of, them stopping, braking at a green light, or stopping without a stop sign. So those would be some red flags that we would be looking for and monitoring. And then of course there is the vision skills related to driving. So this may come up as far as lane position. Are they weaving, drifting, hugging different lane markings, driving the wrong way, or entering, do not enter areas? How thorough is the scanning? So that can come just from, a visual processing perspective, but also, cervical range of motion. Are they able to thoroughly scan that intersection and turn their head or at a yield sign or merge? Same with mirrors and blind spots, the visual attention to the critical items, parking, which they talked about a little in the video as far as being able to judge those distances and adjust appropriately and into the parking spot, as well as judging distances from other vehicles. So that's kind of that visual perception piece of our vision. Identifying, do we have enough space to make a safe lane change, to make our turn with traffic, those kinds of skills. And then another piece, which was also talked about in the video, is how your medications can affect your driving. So some of the medications, of course, with every medication, there could be potential side effects. And that same goes for some of the Parkinson's medication. So some of the common side effects that you can have are daytime sleepiness or fluctuations in your arousal level. And of course, some of you may notice this too as the medications start to wear off, or when you first get up in the morning, sometimes when you first take your medication, it can take a little time for that to kind of kick in. And so that can, of course, impact potentially how you're doing on the road, because we do know fatigue can be a factor with crash risk. So trouble staying alert and awake. Of course, the fatigue kind of goes into as well the concentration on the road. Also some potential changes in demeanor. So for instance, even loved ones kind of looking for that. Are they showing more signs of road rage? Are those potentially related to changes from the medications, or are they potentially just related to changes from the diagnosis that could be associated? As well as, of course, different ones that you would really want to monitor for, which like hallucinations or dyskinesia. So not every person experiences these side effects, and they might be decreased with simple medication adjustments. But of course, if anyone notices these side effects, like you yourself or even loved ones that notice those side effects, you would certainly want to talk to your physician about that, because that can be influencing some of the performance on the road. So that, is important to look at. One of the good websites I want to share with you all. So this is a website which is actually developed by AAA, and it's called Roadwise RX by AAA. And basically, it's a website, a free website where you can input your medication. So you can actually, that's a screenshot there, but you would type in your medication into that white box and then view results. And it will give you different information on potential medication interactions with each other, as well as potential driver warnings and potential side effects that you may see with each medication. Now, again, that's not something that just because it's listed as a side effect, it doesn't mean that everyone has that side effect. But if you're starting to notice those side effects, you certainly want to be aware that could be part of the reason. So this basically, I'm going to talk a little bit about what a CDRS is. So one of the important pieces to know is that there are professionals out there who specialize in the area of driver rehab. Typically, most of us tend to be occupational therapists, but we don't necessarily have to be. And then we're basically therapists who, have some sort of health education or rehab-based background, who go on for specialized training in evaluation and training for those with medical conditions for safe driving. So we are specialists who we will generally do more thorough assessments as far as related to driving, but also can recommend and prescribe different adaptive driving equipment. So one of the ways I kind of think of it from a generalist OT is that I think of a generalist OT or rehab, like physical therapist, for instance, as kind of the primary care doctor. A lot of times they're the frontline people kind of screening for if someone needs assistance or needs more specialty services. And then we're basically like more of the specialist. So I think of like primary care doctor versus a neurologist. So whenever there's a question with driving, that's when people can be referred to us to look at that a little bit further. And then basically the ADED there, what it's written out, so that is the Association of Driver Rehab Specialists. So there are overarching organization that certifies us as to do the work that we do. So typically, you want to look for, if you are interested in doing a driving assessment, you want to look for someone who's certified to do that, because that means that they have that education and they've proven that they've had that education to address those skills. So it is different than a road test from motor vehicle. Like I often describe the road test from motor vehicle, it's basically just a skills test. It's a short, 10-minute drive where they're just looking at how you, brake, accelerate, how you do the turns. And it's kind of a pass fail. Whereas we're really involved to identify diagnosis related issues, how they're impacting your safety on the road, and coming up with potentially different strategies to keep you driving longer. So our goal is, of course, not a fail by any means. It's to keep you driving for as long as possible, and finding different therapeutic strategies to help you achieve that goal. So some frequent questions that we get, which we'll talk about a little bit, but one of the first ones is, why is a driving assessment necessary? And what does it entail? How long does a driving assessment take? If I need adaptive equipment, why can't I order it online? And then what funding sources are available? So in discussing why a driving assessment is helpful, one of the big things to keep in mind are the potential legal issues involved. So just kind of like a DUI would be, medical changes and medications can be considered driving under the influence and can be considered an impairment. Just like we would hope that, other drivers, pilots, semi-truck drivers are monitored and held to a certain clearance or standard, it's the same for all others on the road. So driving after a medical change or diagnosis can be an issue of public safety. One of the things that's important to keep in mind are what the state guidelines are as far as motor vehicle. I would say, a lot of people do not know this, but each motor vehicle does have what's called a medical review board. So each state has some sort of rules as far as what you need to do to report your medical condition and to get cleared with them. And then you also want to consider, of course, the cost of a potential accident or lawsuit. So as far as, if I often describe it as, if someone were to go out and drive and got into an accident that potentially wasn't their fault, if someone pulled medical records and saw that you had some sort of diagnosis such as Parkinson's, lawyers and so forth can try to hold that against you. And they may try to say, well, because of your diagnosis, you were not safe to drive. One of the reasons the driving assessment is helpful is because then it is on file and it's in writing and confirmed with motor vehicle that you went through an assessment and you were deemed safe to drive despite your diagnosis. So it's actually a good thing because it kind of covers you from that aspect. And then one of the things which was, one of the frequent questions is that, why can't I just order equipment online? One of the important pieces to remember, and again, a lot of people don't realize this, but you actually do need restrictions on your license for equipment use. And again, it's meant as a liability thing. For instance, if someone has a restriction for corrective lenses, if that's not on their license, then they're not confirmed to be safe using that. And same goes with any adaptive equipment. So if they had like a steering knob on their vehicle and weren't restricted to use that equipment, and then they got into an accident, well, then that can come up. Well, were they legal? Were they supposed to be using that device? So that's all part of our process, is that we help make sure that we go through the appropriate medical review guidelines, as well as making sure that if there's equipment involved, that we're adding those restrictions. So this is just a screenshot from the Arizona Motor Vehicle website. So again, like I said, I'm just curious, anyone can kind of chime in here, but has anyone known that Arizona Motor Vehicle actually has a medical review process, or were aware that you should have some sort of clearance? And if not, that's okay. So I would say, with a lot of my clients, they don't know that it's not as widely known that there is a process. So this screenshot was just taken straight from Arizona Motor Vehicles website. And it has a section under driver services with a lot of medical review information. So one thing that's important to note in the last paragraph at the bottom, it says, it is the responsibility of the driver to report to motor vehicle any medical condition that may affect the ability to operate a motor vehicle safely. So basically what that means is that Arizona is a self-report state. So your doctor does not have to report your medical condition. It is actually up to you as an individual to report yourself and to go through that medical clearance process. And again, like I said, it's not a bad thing. It's just on file to say, whether you're safe or not. So I always say, even if your doctor has verbally told you that you're safe to still drive, it is good to have something in writing, because if something, God forbid, happens, then it's basically, well, he said, she said, versus having something in writing to confirm that you were deemed safe to drive. And then just some basic information about the Arizona vision requirements and so forth. So these are things that, general public, I don't think always, knows until you have a situation. But this is good information to know, because just as we age in general, things can change, such as our eyesight. So the minimum vision requirements, which is something we test when we're in the clinic with clients, is that they have to be 20/40 in one or both eyes. And they also have to have full peripheral vision in at least one eye. So there are some other things that can be implemented, such as daytime only, or different restrictions such as those, but ultimately to have no restrictions, meaning you can drive at any time of day, you have to be 20/40. And then self-reported conditions, that can be from patients and families, different concerned citizens, law enforcement, and different medical professionals. So with that, even though your doctor does not have to report you, or your therapist or whoever, they can, if there's a concern as far as public safety goes. And then once reported, basically how the process works is, motor vehicle would just send you a medical form. If your doctor felt like you were safe to drive without an assessment, they would sign that off. If they felt like you needed an assessment, that's when they can check that box, and then you would go through a more formal assessment. So they might have possible different medical reviews just based on what the doctor is signing off on there. So why is a driving assessment helpful? So it gives anyone an objective opinion from a driving specialist who will assess you in the vehicle. So I think that's an important piece, because sometimes I've had some clients who, maybe their doctor recommends they not drive. And then the argument is always, well, you've never seen me drive. How do you know I can't drive? And so I think having that actual functional component is important, because then we can identify, okay, are these things able to be compensated for? Have they just declined because of the diagnosis and where things are at this moment, and then what the next step is. And so sometimes it's helpful also having it from a, someone outside the family, because that can just, it can cause family tensions if there's, arguments about whether someone should be driving or not, versus having just an outside opinion on someone's driving skills. And then another helpful piece is that we offer advice to keep you driving safely for as long as possible. Of course, if you're able to continue driving, you don't want to deny yourself the privilege of giving up driving sooner than necessary. But you also don't want to be putting yourself in harm's way if it is time to give it up. And then the other nice thing too is that the driving assessment can provide a baseline. So even in the cases of an early Parkinson's diagnosis, having a driving assessment even before there's concerns can give us a baseline understanding so that we can start to be proactive about trying to keep you safe for as long as possible on the road, but also gives us a baseline so that we can monitor if there are changes that occur. And then, of course, like I mentioned before, we also assist with the state motor vehicle process to help protect you. So this is just a little image of that kind of shows where we might see clients. So there is, of course, the red option. So those are the clients that may have, a pretty significant impairment, and maybe it's pretty clear that they're not going to be driving. In those cases, they may not need to come to us. That might be a discussion that your regular therapist can be screening for, or your doctor can be screening for. And then typically the yellow is where we would come in. So where there could be some impairments going on, we just want to be sure you're safe, and that's where maybe that driving assessment is warranted. And then the lower risk, with Parkinson's, I really wouldn't consider anyone in the low risk category, but I think of those clients as maybe like a knee replacement client. You had a knee replacement, you're now fully recovered. Chances are you're pretty intact as far as returning to driving. So the first part with the driving assessment. So first, what we would go through would be a clinical assessment. So all in all, the driving assessment that we do is pretty comprehensive. It's about 3 to 3.5 hours in length. The clinical takes about 2 to 2.5 hours. And basically what we're going through is some general medical and driving history, goals for driving, meaning, do they want to drive on the freeway still? Do they just want to drive for local errands, or do they want to do longer trips? And then we start going through some assessments. So we do basic assessments as far as driver knowledge. I always tell people, because some people get a little intimidated when they hear that, but it's not anything that you should have to study for. It's general rules of the road that as an experienced driver, you should already know. So it's pretty basic, but just gives us an idea of the cognitive function and things like that. And then of course we do a vision assessment. We do the basic vision screening, but we also assess different components such as color perception and depth perception. Not that the state requires that, but just because they can functionally impact how people do on the road. And then visual perception assessment, we do basic strength and range of motion, coordination, cognition, and then if they have a mobility device, just an assessment of that, more so looking at, do they need something to help them get that device in and out of the car, or are they able to do that on their own? And then the second part of our assessment is the on-road piece. So this is a predetermined route. It's pre-approved by Arizona Motor Vehicle. We are a third party for motor vehicles, so that's why everything kind of gets approved by them to have a set number of skills. And it is in a dual controlled vehicle so that we're able to intervene if we need to. And basically, we are looking for overall safety. We're not out there to trick anyone, and we are not looking for perfection. Our main goal is to just confirm it that they're safe to drive and be out there on the road. So different things that we're looking at are rules of the road. How is their behavior? Are they able to, identify signs and multitask and pay attention to everything at once? And their cognitive and also physical endurance. So as far as the driving assessment goes, this is basically how our process works. So first we get a referral, and we do require a referral generally from the doctor. So you can see that down below. The main reason being because as occupational therapists, we work under a doctor's order, but also because we want to be sure that there's no pre-existing conditions or different medications, a history of seizures, things like that, that we may not know about, to make sure that, you know, we're not wasting your time or your money by being there either. So we start the referral, and then you would identify a funding source, and then we initiate an intake. That's basically just initiated with our client coordinator on the phone, and then we schedule the evaluation. And once we complete the evaluation, we discuss the recommendations at the end of that appointment, and then communicate those results to the referring doctor, the motor vehicle, and to the client or family. So some common funding sources here. The VA is a one funding source. Vocational rehab is another one. Now, I would say generally, you know, of course, vocational rehab, their main goal is employment. So if you are working or have a goal of returning to work, they would be a potential source for you. However, if you're retired, they probably, you know, wouldn't be a source in that case. Workman's comp is another funder that pays for our services. Private pay, and then there are some third parties out there that will help with the funding. So one of the big questions we get is, why hasn't my doctor discussed driving with me yet? And some patients kind of assume that because it wasn't discussed yet, that maybe they're just good to continue driving. But I will be honest with you that there are many doctors out there who don't discuss driving, and they kind of just avoid that conversation. Sometimes it's because they don't feel like they know enough about driving to feel confident in providing that advice. They also may not be familiar with the state motor vehicle guidelines. They may have other concerns that they're focusing on. Of course, as you know, with insurance, sometimes insurance can be tricky, and they have, you know, X amount of minutes to spend with you. And so sometimes driving can fall to the back burner with that. And then another big reason that it shows even in research is that the clinician does not want to ruin the doctor and patient relationship. So sometimes they just don't bring it up because maybe you've gone to that doctor for a long time, and, you know, they want to kind of keep the peace. So I think with that, with knowing that, it's really important that you be proactive and be your own advocate. And if you haven't already done so, I would suggest asking your doctor or your therapist about your continued driving potential. There are certainly different screening tools that they can do in the clinic to identify, do you need a driving assessment or do you not? And if they're uncertain as far as your abilities, then certainly a driving assessment would be warranted. So some different strategies to just help prolong driving safety. Of course, the importance of good sleep. And like we mentioned earlier, some of the medications can impact some of that sleepiness. And so if you do notice any sleep concerns, discuss that with your doctor. Importance of physical fitness, just to maintain strength and range of motion for as long as possible. Yearly eye exams, which I think is great for all of us to do, just to monitor as we age in general. And also asking your eye doctor to assess for different things. These are things that we assess for related to driving. So contrast sensitivity, which looks at your how well you see in low contrast, like with driving at night or with glare and fog, depth perception, and visual field. The reason I say to ask your doctor to assess this is because they don't always assess this. You know, at your yearly eye exams, a lot of times they have set things that they're looking for, like your acuity, checking if you need updated prescription in your glasses. So they may not be assessing all those extra pieces there. And then some other strategies, just kind of keeping in mind the medication management. So being consistent in your medication schedule, being wary of when medications kick in and when they wear off, and monitoring your side effects. So if you start to notice, that your medication's wearing off, or you're having really noticeable fatigue, kind of having a backup transportation plan in place so that you're not having to drive yourself in those situations. And then things to just kind of keep you driving for as safe as possible. Consider the time of day that you're driving. So again, giving your medications time to kick in. If you are noticing glare issues or difficulty seeing in low light, avoiding night driving, driving at non-peak hours. So those are things that we can kind of limit in our day-to-day to just be proactive about trying to keep us safe for as long as possible. Some other strategies are limiting driving to familiar and more predictable routes, limiting distractions such as radio, even GPS. I know I have some clients who's like, sometimes they'll, if you have a memory impairment, you may say, oh, I'll use a GPS, but there's cons to that too, because now you're adding extra distractions into place. So of course it can help you with the pathfinding perspective, but if there's divided attention deficits going on, they may not be able to multitask and pay attention to the GPS while paying attention to the road. The other things are just doing monthly check-ins. So I often, even when I see clients and say, yeah, you're good to continue driving for now, I think it's important to do monthly check-ins with family members. So having a family member ride along as a passenger, just to monitor for changes, because there can be a progression, of course, and so you want to be proactive about watching for those red flags. And then involving a CDRS early to help provide an individualized assessment. So some different possible adaptations related to Parkinson's. So generally the adaptations are more for the physical deficits. How are we compensating for those? Whenever there's vision deficits involved, that's when the eye doctor would come in to determine, do they need updated glasses, or are there different adaptations from that perspective? Versus the cognitive, generally when there's a cognitive decline, there's only so much that we can do to adapt or compensate for those things. For instance, when your reaction time slows, you either have that reaction time or you don't, and there's really no way to adapt to that. But some possible adaptations from the physical aspects would be blind spot mirrors. So if someone has, doesn't have that cervical range of motion needed, blind spot mirrors, or even the technology-based things like the blind spot monitors on the cars, backup cameras, the steering device, which you saw a little bit in that video. So if there's shoulder issues or difficulty turning the wheel, that steering device can help compensate for that. And if there's postural issues, so trunk support issues, we have what's called a chest strap that can help provide some external support for that. So this is just a little screenshot of some different things to kind of monitor for. This was taken from the BCAT, which is a cognitive assessment out there. But they have this driving self-assessment with some great questions that when I ask clients to do that monthly ride along with family members, these are things I have them screening for. And if they're answering yes to a few of these questions, then it would indicate that they either need a driving assessment or there needs to be a discussion about maybe that it is time to give up driving. So one of the important pieces, so of course, one of the topics that none of us want to talk about, but it is important, is that with a diagnosis such as Parkinson's, it's progressive. So there can be a time where you may have to give up driving. So I often say, just as we plan to retire from work, we should plan to retire from driving. And so it's good to be proactive. When we retire from work, we generally, plan for years as far as how we're going to fund that. And driving is similar. Sometimes if it's an abrupt change where all of a sudden you have to stop driving, it can be a hard transition. Versus if you start planning ahead early and have things in place, it can make that transition a lot easier. So one of the things I often tell people is, even if you're safe to drive for now, it's good to plan for the future, and begin to discuss with your family as far as, or friends, what the plan is going to be for transportation. Starting to even use different alternatives before actually needing them, making some of those proactive changes on when or how you're driving, schedule dates to run errands or attend appointments, and using different delivery services, or doing things electronically, such as banking or pharmacy, and then identifying others that attend the same social events. So like I even think about, different church groups and things like that. You may be able to work that out so that you're going at the same time, you're able to get rides from other people. So just some different topics. So of course, the cost of the liability in case of an accident, which we did talk about a little earlier, that you want to consider. And then, of course, the need to be proactive and address driving cessation now before an accident occurs. Some other things, which this is always a difficult discussion, but I think it's important to emphasize when it does come time to retire from driving, the safety for themselves as well as others on the road. Of course, like I said before, it's never the goal for someone to give up driving. But sometimes it can happen, especially as the disease progresses. There are things that are just out of our control. So it's important to identify those things early to keep you safe, but keep other people safe out on the road. And then discussing suitable transportation alternatives. So I think I kind of underlined suitable there because it's important to remember what is appropriate. So if there's mobility concerns, for instance, the riding the city bus may not be a great option for them. They may have to have other alternatives in place. So kind of coming up with a plan with those more appropriate solutions. And then some other considerations, such as considering the cost of vehicle ownership versus transportation. There are, of course, owning a car, you have to consider gas prices, car insurance, maintenance fees, etc., versus putting that money towards transportation. And then, as I said earlier too, the third-party driving assessment can be helpful, even when you or the family feel it's clear the person shouldn't be driving. And then there is a link down there, which is really helpful for, has some really helpful resources as far as what driving assessments entail, tips to keep you driving for as long as possible. So that's a really great resource with the Hartford. So in some cases, you may know it's time to give up driving, even without a formal assessment. And these are some options just to consider as far as helping in that transition. Of course, you have the obvious ones like family, friends, different social groups, hiring like a home care agency, Uber and Lyft, or there's actually one that's also called GoGo Grandparents, which you don't need a smartphone to use it, which is, it uses Uber and Lyft services, but you can access it without a smartphone. You call like a concierge service and they set up rides for you. So that's a nice one because it's convenient and on demand, but you also have that luxury of, just being able to get a ride when you want and without having to schedule it ahead of time. And then medical insurance sometimes will cover transportation to and from doctor's appointments, as well as if you're a veteran. The VA does provide transportation. They also provide driving assessments. So if you are a veteran, I highly encourage people to go that route and try to get an assessment and be proactive about that. So how to discuss some concerns. So sometimes it can be difficult for anyone to accept a driving retirement recommendation, even when if the doctor and therapist has not seen them drive, it's even more difficult. So that is why the driving assessment can be helpful. If you are a family member, it's also things that you can discuss with them. So I think it's important not to give examples of poor driving while the person is driving, because that's just adds to fuel to the fire. Try to give more concrete examples of concerns when you're at home. So some of those checklist items like we discussed earlier, as well as different things like dings in the car that you're noticing, fender benders, things like that are more concrete examples. Anticipate a negative response. So any lifestyle change is going to be difficult, and it does take time to accept that. So just, be prepared for that. And I think the most important piece is that you're there to support them through that transition. Discuss your concerns, if you have any, with your loved one's doctor. And then, of course, considering an in-vehicle assessment to give an outside opinion. Some things just to note is that everyone ages at different rates. So also varying levels of diagnosis issues. So even with Parkinson's, I mean, you can be early on in your diagnosis where you have very minor deficits to pretty significant ones. And so there's not a true, black or white answer as far as Parkinson's and driving, but it is important to have that individualized assessment because it does vary case by case. And then remind them it's common to make changes at home, just like you would for, driving with age and meal times and so forth. And understand that driving is important for independence and self-esteem. So your loved one can become defensive and upset. So some different takeaways. If you haven't already done so, I would suggest you ask your doctor or therapist about your continued driving to just start the conversation. As I mentioned earlier, you have to be proactive about it. And so that the earlier you start those conversations, the better. If your abilities are in question or for your loved one, ask for a referral for a driving assessment. And then if your doctor does clear you, even without a formal assessment, I think the biggest piece I try to educate people on is to make sure that you go through that Arizona motor vehicle process. There is that medical form, which I'm also always happy to send to you. I have my email at the end so that you can initiate that and have your doctor sign off. Again, just so it's in writing that you are covered from a legal and liability perspective. So your diagnosis cannot be held against you. And then these are just some helpful resources. I know Callie is gonna, share my PowerPoint at some point, but these are great resources just for you all to have some things to go to. So there is the directory of different driver rehab specialists. Of course, like I said, we're based in Arizona, but they are nationwide. So that website, aided.net, you can go right on there and search by state as far as all the different specialists across the nation. And then there are just some other helpful resources as far as different educational things with helping with different discussions and so forth. All right, so that's the end. And that's my info down there. I know PWR is at Power is in Tucson, but that is our address up top at the Tucson location, just for those of you who have some interest. So I'm gonna kind of open things up for any questions. I know we have a few minutes here.
Yeah, so if anyone does have a question they'd like to ask, feel free to unmute yourself or type it into the chat and I can read it out loud for you. I know one question I had, Lea, is do you have to have a referral to get the assessment, even if you're going to pay out of pocket?
We do, still because of the being an OT and still because of the medical review process. Because of the fact that there's a diagnosis, we always will go through that medical review process to clear someone. And so we always want a doctor on board to be able to sign off on that.
Awesome, thank you.
Yeah.
All right, I know somebody has a question, Shirley, come on now. And you said the whole process takes about 3 to 3.5 hours with the kind of assessment and then the driving afterwards?
Exactly. Yep. So we start with that clinical piece and then we do go in the car for that second part. And I will tell you that clinical wise, there's not a pass or fail. Even if someone has impairments clinically, I'm still going to take them on the road because I want to see how they drive. There are certain pieces that, of course, correlate or indicate crash risk, but there's not one assessment that can tell us how someone is going to drive. And that's why there's so much weight on that in-vehicle piece.
Okay. Do you guys do like follow-up appointments after the assessment at all? Or is it just like the evaluation and then done?
We do follow-up. If it's, so if we drive during the assessment and maybe there's like fine tuning that's needed or different adaptations, we could recommend that. There's also potential for restrictions. So if someone maybe, does okay in town, but doesn't want to drive on the freeway or doesn't have those abilities to drive on the freeway, we can look at different, like a no freeway restriction or a mileage restriction if there's memory concerns. So there is opportunity for follow-up versus like motor vehicle, which is just kind of a pass, fail, done kind of thing.
Yeah. Awesome. And then we did get some questions in the chat here. One of them is the cost of the assessment.
So our cost down in Tucson right now, it's a flat fee for the assessment. So it's $642 for the assessment. We do require a $50 deposit to hold the appointment. And I know it's definitely costly, and that's sometimes a deterrent for people. One of the things I try to steer people to is that if you have the ability to use those funding sources like the VA, I try to encourage people to do that route. I also look at, of course, medical insurance does not cover driving because they don't view it as a medical necessity, which is some of the reason why it's a private pay service. But ultimately, if you consider the potential cost with liability and so forth, that's where sometimes that cost can be justified.
Okay. Do you know if the Department of Labor covers the cost of the assessment?
I don't know off the top of my head. I've not had anyone through the Department of Labor that's covered it. I know like with vocational rehab, they're through the Department of Economic Security. There used to be a branch, independent living, which they would previously pay for it, but their funding got cut within the past year or so. So now they only work for those who have an employment related goal.
Okay, gotcha. Another question we had is, how has the driving assessment changed with the advent of driving technology, like self-parking vehicles?
Yeah, so it hasn't changed much because as a skills perspective, you still have to be able to demonstrate those skills. With technology, it's great, but there are glitches and you can't rely on that 100%. So like I think of, okay, if your car broke down and you had to rent a car that didn't have that technology in it, would you still be able to do that? So although sometimes those features help and they could be an asset to someone, we don't rely on them 100%. We still want to make sure that they can demonstrate the skills needed without them.
Yeah, because the assessment wouldn't be performed in your like private vehicle, correct?
Correct. Yeah, we have them on our evaluation vehicle, mainly because, well, first of all, motor vehicle requires it because of the dual controls, but also because of insurance purposes. We have to have a pretty high insurance policy, and that's part of the reason as well. So I often describe to people, like, I know it's not as comfortable as driving in their own vehicle, but it's kind of like renting a car. And like I said before, we're not looking for perfection. We're just looking for, are they safe to operate a vehicle overall? Okay,
great. And then the other question was, how do I find out if my state offers these evaluation services? Is that the ADED website?
Yep. Yeah, I would go to that www.aded.net. And then they have a directory at the top. You can, they have a tab that you can search by state for your driving evaluator. Also AOTA, which is the OT Association, they also have a directory on their website.
Perfect, thank you. All right.
I'm waiting for cars that drive themselves.
I know, me too.
I had one question. Is it, if you have the assessment done, is there a possibility that your insurance rates would increase?
No, they will not. So our report is reported to motor vehicle, but ultimately insurance companies, it's kind of like anything else. They can't discriminate just because you have a diagnosis. Ultimately, if you have a valid license and you're deemed safe to drive, that keeps you safe. That means that you're safe, and they can't question that.
Okay.
All right. Another question we got was if there's any self-assessment tests that you can do outside the evaluation to kind of alert them to a need for an evaluation with you.
Yeah, so there on the PowerPoint, which I know Callie will share, there's that one slide. It has like the driving self-assessment, and it goes through a bunch of different questions. That I think is a great precursor for you yourself to assess, but also for family members, because sometimes it is hard to recognize those things in ourselves, things that we might make on the road, but like errors that we might kind of say, oh, you know, it's fine, it's not a big deal, but maybe it is really a big deal. So I would say questions like that, like if you've had recent fender benders, if you're noticing you're getting lost, if you're noticing difficulty getting to the brake or you're stopping closer than you previously did, those can all be signs that maybe there's been a change.
Have you found any effective ways for patients to practice driving without actually getting into a vehicle to drive?
So meaning, are they returning to driving after not driving for quite some time?
I'm not sure. It says like, for example, like video games or driving simulator.
Yes, so there is one app. It's more developed for new drivers, but really anyone can use it. There's an app on tablets that you can get. It's called Drive Focus. It's about $12 or so to download, but it basically goes through these simulated drives, and people have to, you tap on all the important things in the driving environment, and they get a little more complex and faster paced as you go to work on that visual scanning. But I will say that you know, that's a great precursor. But a lot of times with experienced drivers, they've driven for so long, so they shouldn't really have to relearn those things. Of course, unless it's something where you maybe haven't driven for years and now you want to get back into driving.
And then I'm just kind of curious, is there ever a time where, I don't know, like a patient would want to get the assessment, but their doctor doesn't like get the referral? Is there like another referral source? Like if they're just like, nope, I'm not gonna send that referral for you.
Yeah, I would tell you that like I don't have knowledge. I think most doctors are very much so in support of doing the driving assessments and being proactive. But really, we can get a referral from any doctor, any nurse practitioner, as long as someone is on board is the main thing.
Okay, great.
Have them sign off on a statement where they're responsible if you have an accident. Then they'll give it to you.
All right. Any other questions? This has been so awesome, Lea. I know I've had so many people ask me about driving, or their doctors have just said, right when they're diagnosed, no more driving for you, you know,
Right.
even early on, which I think is so unfair. So I'm so grateful for you taking the time tonight to do this for us.
And I will say that you're right. That's quite common. And I will say that I've had many people with Parkinson's who are still safe to drive. Just because you have a diagnosis of Parkinson's does not mean it's time to give up the keys yet. There could come a time, but I think that's not our intent. We want to try to keep you driving for as long as possible. So just kind of keep that in mind too. But yeah, you have my email is there on the last slide there. So if anyone has any questions that come up, feel free to email me, and I'm happy to send over different resources or answer your questions as best as I can.
Awesome. Well, thank you so much. Well, we'll go ahead and shut it down here unless anyone else wants to unmute themselves for a question or just tell Lea thank you.
Can you hear me?
Thank you.
Yeah.
You can hear me?
Yes.
Yeah, my wife just went through a intensive test for cognitive and what have you. It was a 4-hour test. And the doctor reported today that she thought that she could do limited driving areas where she was comfortable with and familiar with and what have you.
Right.
Is that okay?
Well, so at the very least, if the doctor is telling you that, I would get that medical form, because regardless of the diagnosis, you would want to have something in writing to say that that doctor said that. Because, you know, God forbid she goes to the grocery store tomorrow and something happened. Well, then it's a question of, did the doctor say that? Was it in writing? So forth. So I would say get that medical form completed at the very least. But also the doctors, you can ask them about, do you think a driving assessment would be helpful in her case? We see clients with cognitive impairments pretty frequently, and there are things that potentially we could implement or determine, you know, on record whether they're safe or not.
I missed. Where do we get the medical form?
I can always email it to you. So if you wanted to like type in your email to Callie's chat box, if you don't mind, Callie,
Yeah.
and then you can send it to me, and I can always send you that information.
Okay.
You can do that later.
Yeah, and you guys can always email me as well. I'll put my email into the chat for everyone. We also have just our info at Power for Life as well.